Okay, so this next video clip is going to look at some of the examination basics as it relates to evaluating knee extension on our patient. So we're going to use something called the terminal knee extension movement pattern, and that's done with the patient in toe-touch weight frame. So Hannah, I want you to take your right toes and kind of go into a tiptoe position on the right. Okay? And we may need to use active assisted motion just to demonstrate the movement briefly for the patient. I want you to try to straighten your knee and then let it bend. Okay, and straighten that knee and let it bend. And we visually observe whether or not our patient has an ability to fully straighten the knee. Okay? Now let's look at the involved knee. Okay? So please come up onto your tiptoe on the left side. Okay? And as best as you can, I want you to try to straighten the knee, push it backward, and then let it flex forward. And try to push it backward and let it flex forward. And we get in a position to visually observe whether or not our patient can fully straighten their knee. If not, if it appears restricted, again, it's our job to take a nice goniometric measurement, try to hold it there, try to straighten as much as you can. Do your best with your axis point and your stationary and your moving arm, and get a measure of knee extension. Now relax that knee just for a minute. Remember, pain stops active movement. So we need to determine whether or not a pain impairment is limiting Hannah's knee extension. So now we come in behind the patient. We'll bring our hand to the medial distal femur, and you try to straighten the knee as much as you can now. And at the end of her available active movement, we're going to pull the distal femur in a posterior direction. And if that causes discomfort, again, we need to clarify with the patient. Do you feel that was stopping your movement? And if it was uncomfortable, where was it uncomfortable? And what was the intensity of the discomfort, and what did that pain feel like to you? Okay? Last thing we can do here, right in a standing position, to save time and be real efficient in the clinic, we can test the end feel. Is there any capsular restriction limiting Hannah's knee extension? So now, please let me make the movement for you. I'm going to bring one hand in medially, another hand in laterally, and I'm just going to try to straighten the knee, just like that. And I feel for an early, firm end feel. If there is capsular shortening, it would be the posterior capsule in this case. Hannah might feel pulling sensation in the popliteal region of the knee.